All right. It's been about a month and a half since the World Health Organization declared COVID-19 a global pandemic, and we're all coming around to the fact that COVID-19 is going to be with us for quite some time. But even when there is a pandemic going on, we know that other medical emergencies like strokes and heart attacks don't just stop. Across the country, hospitals and media are reporting a decrease in emergency room visits from people with conditions unrelated to COVID-19. And there's concern that people aren't calling 911 or are avoiding the hospital out of fear for the virus, or perhaps because they don't want to burden the healthcare system unnecessarily. And I can tell you that at VCU Medical Center in our own emergency department, from March 20th to April 20th, VCU Medical Center saw a 37% decline in patients seeking emergency care for stroke compared to the same time last year. When it comes to strokes and heart attacks, ignoring symptoms and delaying care can be a serious problem. So I'm joined today by Dr. Daniel Falco, Interim Director of the VCU Comprehensive Stroke Center, and Dr. Michael Cantos, a cardiologist and medical director of the VCU Health Coronary ICU. And we're going to talk about what exactly are the symptoms of a stroke and a heart attack. What should you do right now, even during the pandemic, if you feel like you're having a medical emergency, and the measures that we have in place here at VCU Health to keep everybody safe. So thanks for joining me, Dr. Falco and Dr. Cantos. If you don't mind providing a little bit of background on what you both do. Dr. Falco, we could start with you.
I'm Daniel Falco. I'm a stroke neurologist. I'm serving as an interim medical director for our VCU Comprehensive Stroke Center. And we are here taking care of patients with stroke, both hemorrhagic and ischemic strokes.
And Dr. Cantos?
Thanks, Alex. I'm the medical director of our cardiac intensive care unit. So I take care of patients who come in with heart attacks and other serious cardiac issues. I'm also the co-director of our chest pain evaluation center. So patients who come in with chest pain, other symptoms. So we have a system that's designed to follow them from the beginning of the emergency department through their hospital course.
Excellent. Thank you both for joining me today. I think what I'd like to start off with is just the basics. So Dr. Falco, if you wouldn't mind explaining what exactly is a stroke and what are the symptoms and how would somebody know if they're having one?
Sure. So we commonly refer to stroke as a brain attack, right? It is a neurological, it is a medical emergency. It occurs when blood vessels in the brain, which we call arteries, right? They are blocked or ruptured. There are two types of stroke, right? When the vessels are blocked, we call it ischemic stroke. And when these vessels are ruptured or just burst, that's called a hemorrhagic stroke. And the consequence of a stroke can be long-term disability or even death.
And how would somebody know if they're having a stroke?
The stroke symptoms, we refer to them with the word FAST, which stands for face weakness, arm or leg weakness. The S stands for slurred speech, and the T is for time, because as we see, the management of stroke is time dependent.
And so similarly, Dr. Cantos, I know that there may be other cardiac emergencies. How would somebody know if they're having a heart attack?
Well, typically the symptoms of a heart attack are described as a mid-chest pressure, tightness, squeezing, burning, or interdigestional-like discomfort that occurs in the mid-chest. Although we typically talk about patients who have heart attacks as having chest pain as the primary symptoms, many patients actually don't perceive this as a true pain, but it's just a very severe discomfort or uncomfortable feeling with sensations like I described above. So the symptoms are usually in the mid-chest wall region, but can be on the left or right side of the chest, and often extend into the left arm and sometimes in the right arm or into the neck. When patients are having a heart attack, they usually are severe, but not always. Some people, particularly older patients, may have more atypical presentations. They may just develop neck pain or just arm pain, and particularly patients over the age of 75 may present with more shortness of breath and less chest discomfort.
So, Dr. Cantos, if I or one of my loved ones, if I think they're having a heart attack, what should I do?
Well, the first thing you should do if that happens is call 911, particularly if they last for more than a few minutes, and that would be more than 5 or 10 minutes. we strongly recommend that you call 911 rather than driving yourself to the emergency department. One of the advantages of calling an ambulance is that they can provide direct medical care if you do become more sick while you're waiting. And second, they can often perform an EKG. That allows us to provide early diagnostic information so that if you are having a heart attack, when you do get to the hospital, your care will be rapidly accelerated and you'll get treated much faster.
Is that any different now? Has anything changed in what I should do if I think I or a loved one are having a heart attack? I know during the pandemic, I might have a little bit of fear about calling 911 or coming to the hospital. Has any process changed in that, or should I still continue to do that?
The overall process really hasn't changed. You may see some things that are different. For example, if you're complaining of shortness of breath, when the EMS provider gets there, they'll be wearing personal protection devices just in case you may have coronavirus. But otherwise, what you should do, calling 911, seeking immediate medical help, which is exactly the same as before the pandemic.
So similarly, Dr. Falco, if I think I'm having a stroke, or if I think my loved one is having a stroke, what should I do? You kind of touched on this earlier with the fast, but what should I do specifically?
Good question, Alex. Similar to a heart attack that was mentioned before, you should call 911. Do not wait, right? We should not delay care, even in the midst of the pandemic. A stroke is still a medical emergency that can cause major disability and even death. So there should be no delay calling 911 so that we can have a prompt management upon arrival here in our ED. Stroke management is time dependent, and the modalities of treatments, they're also time dependent. We can even address a patient with a stroke to receive a medication called IV alteplase, which is a clot buster medication, but also some patients may be eligible for an invasive procedure that we can attempt to remove the clot via a catheter. Those two procedures, treatments are time dependent.
Have we been treating stroke patients throughout this pandemic?
Sure. So you look at the pre-COVID, which is not long ago, right? We're talking about weeks ago. So I remember giving a talk on the stroke some months ago. If you look at the incidence of stroke at United States, every year, more than 709,000 people in the United States have a stroke, right? Someone has a stroke in the United States every 4 seconds, and every 4 minutes someone dies of a stroke. It's still a leading cause of death and leading cause of serious long-term disability. And I do not believe that has changed. What we are seeing here is, I think, as a result of delayed diagnosis because of patients not presenting promptly to the ED when they need that time-dependent care. As you mentioned, Alex, we looking at our data, we have seen a decrease of about 37% of stroke admissions through our ED here. And I think that's a result of that. But we should recognize that stroke is still a major cause of long-term serious disability or even death, even in the midst of the pandemic.
So we've kind of touched on this, but should I be scared to come into the hospital right now? And what safety measures can I rest assured that VCU Health has in place?
No, we acknowledge the context of COVID. We acknowledge that. And we have adapted our stroke processes and protocols in our hospital to this new reality. And this was done to maintain patients and providers safe. And I can assure you and all our viewers is that if you or a loved one have symptoms of stroke, do not hesitate calling 911. Upon arrival, you will be safe. We have adapted our protocols to still provide safe and management of stroke, even in the context of the COVID pandemic.
And similarly, Dr. Cantos, I know heart attacks, it's another medical emergency, just like stroke, but there are different protocols. I mean, should I be scared, or what safety measures do we have in place if somebody comes in with a heart attack?
Well, I can understand why patients may be afraid to come in, just particularly when they see all what's been going on in the news with people with infected with coronavirus. But as Dr. Falco said, we've put a lot of safety measures in place. If you come in through the emergency department, we do screening questions to determine if anyone actually is at risk for having coronavirus. We separate out patients, so your likelihood of being close to someone, we do do practice social distancing, or probably better phrased as personal distancing, since we don't want people to stay away from out of contact from each other. And we've done some other things, which you'll notice if you do come into the hospital, all the healthcare practitioners are wearing masks. This is both for your protection as well as ours. One of the downsides of what we've done to try to improve overall patient safety is we do no longer allow routine patient visitors to come in. So that can be somewhat distressing for patients. To try to answer that and to reassure patients, what we've been doing is instituting a process in which all patients will have access to an iPad in their room, so they can actually contact their family members and still maintain contact with them even though they are in the hospital.
And I've heard some great stories of patients being able to access their loved ones via that technology. And what I just wanted to basically ask now, I'll start with you, Dr. Cantos. Is there anything else that you want people to know at this time with these conditions right now?
I would just like to emphasize that if you are having symptoms that can represent a heart attack, don't delay. You should come to the emergency, call 911 as quickly as possible. You'll get your care faster, and this will limit the amount of damage to your heart if you are having a heart attack. Hospitals have put safety measures in place, so you will be protected from that. And being in the hospital when you're having a heart attack is the best place to be.
And Dr. Falco, is there anything else that you would want to say for those who might be having a stroke or know somebody who may have stroke symptoms?
I will echo the same statement. We remain a safe place for the best care you can receive for stroke here, even in the midst of the pandemic. Do not delay care. If you have symptoms of stroke, if you have symptoms of slurred speech, facial droop, arm or leg weakness, do not hesitate to call 911. We'll provide the best medical care and the safest.
Well, thank you both so much. This has been very helpful. And for everybody who's watching, you can get the latest information on care during COVID-19 at vcuhealth.org/COVID-19. Thank you, Dr. Cantos and Dr. Falco. Really appreciate the time.
My pleasure.
Thank you.